So the next speaker is Dr. Ankit Agarwal, and Ankit is his paper is an innovative low-cost dry eye treatment. So can we have the presentation? Yeah, Ankit, are you ready?
Yeah.
Yes, please go ahead with the timer.
Okay. Thank you. Thank you, AIOS, for giving this wonderful opportunity. The topic is innovative low-cost dry eye treatment. I have no financial interest in the product which I have shown here. So dry eye is defined as this function of lacrimal functional unit comprising of lacrimal glands, ocular surface, and its lids, sensory and motor neurons. So the most common type of dry eye which we encounter in our country is meibomian gland dysfunction based dry eyes, which is more appropriately termed as tear film dysfunction. Most commonly, MGDs are associated with diabetes and poor lid hygiene. And as we know, India is slowly becoming a diabetes capital of the world, so increases the MGDs. The treatment modalities available for dry eye range from topical lubricant drops like carboxymethyl cellulose to anti-inflammatory agents like cyclosporine and steroids. So various device-based therapies have come up in recent years like LipiFlow and IPL. The LipiFlow works by heating and expression of the meibomian glands, and IPL works by reducing the meibomian inflammation by an unexplained phenomenon. So these are the two machines which I am talking about. The problem is that these two devices are very costly. They range from something in the range of 25 to 30 lakh rupees and it becomes difficult for doctors as well as the patients to afford the therapy on a long-term basis. So only a select few who can afford these can possess the machine, and only a select few patients can get the treatments. So the purpose of this study was to describe the innovative low-cost dry eye therapy system as compared to much costlier alternatives which are available in the market. The study was performed at a tertiary eye care center north of India. Therapy protocol was designed where a low-cost heater cum massager, which is easily available online. I purchased that, and I designed a protocol to treat dry eye diseases, which is caused due to meibomian gland dysfunction. A data of 39 patients aged between 43 to 59 years was collected. Of these, 27 patients underwent therapy using this novel device, and 12 patients, the therapy was done using traditional method of warm compresses and massage of eyelids twice a day. So this is the eyelid massager which I am talking about, and this is the patient undergoing this therapy. So what happens is, this massager, it maintains the temperature of around 104 to 107 degrees Fahrenheit. That is approximately 39 to 42 degrees Celsius. And it has various massage points. That is, it compresses the eyelids at various points so that meibomian expression is done and the meibomian gland blockage based is reduced. The device is used for 15 minutes at a time and once every 3 days for 15 days. That is, a total of 6 sessions are taken. At the end of 1 month and 3 months, the following diagnostic checks were carried out. That is, Schirmer's test, TBUT, and OSDI score was taken at the beginning, after 1 month, and after 3 months. All patients were prescribed 1% carboxymethyl cellulose eye drops, irrespective of which therapy protocol they are following. The results of these 3 tests were compared and those from before the treatment. The results were that the low-cost device reduced the incidence of MGD at 1 and 3 months as confirmed on normal post-treatment Schirmer test and tear film breakup time. The traditional treatment group also had significant improvements, but lesser than the treatment newer device protocol. The patients in both were symptomatically much better from the before therapy as confirmed on the OSDI scoring. So this is the flowchart regarding this. So mean value of Schirmer's pre-treatment in the novel device group was 24.8 millimeters and the traditional therapy group was 25.3 millimeter. However, at 1 month therapy, the novel device group had reduced Schirmer's to 16.7 and the traditional method was 19.1. This increase in Schirmer's was in MGD is basically due to inflammatory reflex of the tears. At 3 months, the inflammation reduced further and the Schirmer's test came back to within almost the normal limit, 14.2 millimeter and 14.7 in the novel and traditional therapy. The T-but consequently increased. The mean pre-treatment T-but values were on an average 3.3 seconds, which increased to 8.5 and 11.1 seconds at 1 and 3 months in the novel device. And in traditional therapy, it came to 6.4 and 9.1 seconds. At 1 month of therapy, the patients who underwent treatment with the novel device had much improved Schirmer and T-but values as compared to traditional treatment group. At 3 months, there wasn't much difference between the two groups. So this innovation is a low-cost MGD treatment alternative to devices which are available commercially, and thus makes the therapy accessible to a majority of doctors and patients who otherwise would not be able to afford to buy them or pay for their therapy, respectively, due to financial constraints. Thank you.
Can I have a question? So you mentioned the improvement in OCD questionnaire.
Yes, sir.
So
Yes,
okay, what symptoms they actually improved best at the 1 month?
Yes, ma'am.
So what symptom?
The symptoms which the patients definitely said that they had lesser pricking sensations, less feeling of dry eye, especially when they are driving, so less watering when they are driving. So these symptoms, because I tried this therapy mostly with patients who are working. So they had their complaints were mostly when I'm looking at the computer screen, I'm having watering. When I'm driving, when I'm having watering and pricking sensation in the eyes. So these patients improved significantly.
Thank you.